you uh, in our respective offices. Going to be talking about a topic today that uh, for a lot of people might be a little odd. I know for me, I've heard the term many, many times. I've also heard just the general term of personality disorders, but in particular, borderline personality disorder seems to be getting out there in the vernacular. Doctor, could you tell us what the heck it is and what's the difference between that and a normal personality disorder if they're distinctly different things, and how it also relates to bipolar disorder? Because and the research that I did, it seems very similar.
Well, we're gonna talk about the different aspects of borderline personality. I have to tell you that in my profession, in medicine and psychiatry, borderline personality disorder has become almost like a bad word.
Mm,
A word that it shouldn't be. That when you hear tells you that the patient is a bad patient, and I'm going to try to explain to you why we need to change that. And the reason that has become so popular to talk about borderline personality is because people with borderline personality tend to be significantly intense. And
mm,
we're going to talk about the intensity. However, we cannot talk about borderline personality without talking about normal personality, right? Because in order for us to understand personality, we have to understand that personality is never normal. There's no such a thing as normal personality because the variations are so wide that it's almost impossible to narrow it down to say if you have these features, you're normal. So instead of normal personality, we should talk about adaptive personality.
mm.
So the best adaptive personality actually is all of the abnormal personalities in good balance. What does that
So,
mean?
so a little schizoid, a little bipolar, a little depressive, a little all that.
A little bit of
Okay.
everything. So that reflects what the purpose of personality is. Why do we have a personality? Well, the personality is the features of our being that allow us to deal with the world in adaptive ways. So we're not fighting with each other all the time or being sensitive to rejection all the time or very paranoid all the time or very narcissistic all the time. But we can be a little bit of that, all those different features depending on what life is asking from us.
Mhm.
So a lot of our defense mechanisms are going to be based on the personality traits we have, right? When we talk about personality disorders, we're really not talking about illness. We're talking about intensity.
Hmm.
Remember, in medicine, everything is about how much, how often, and what is it doing to your life, right? So you can pick diabetes or hypertension or depression or schizophrenia. And when you talk about the symptoms associated with those illnesses, you always have to put them in the context of how many symptoms you have, how intense are they, and what are they doing to your day-to-day life. So are they affecting your relationship seriously? Are they forcing you to deal with life in aggressive ways? Is it keeping you from going to work? Is it keeping you from being able to have healthy relationships? So the functionality part is essential to the diagnosis, if you may. It's not a purpose of this talk to get into diagnosis, which is another controversial issue, in terms of how do we arrive at a diagnosis. But when we define normalcy or adaptiveness, it means that if you need to be dependent on someone at certain times, you can be. If you need to be a little narcissistic and proud of yourself, you can be. If you can be a little paranoid, you can be. If you can be a little obsessive, you can be. But not to the intensity and frequency that will cause problems in your life. Right?
And that's really in lieu of a normal definition. It's really that you can be intense, you can be this, you can be that, as long as it's not overly intense, overly frequent, and which leads to dysfunction. That is quote unquote normal.
Yeah, but you see, it's really fascinating when it comes to behavior that, especially when it comes to your personality, in that we actually have never defined a normal personality. You can get any text and it's not going to tell you this is normal, right? because normalcy is a huge wide range of different behaviors. Now, we have to separate personality from other type of disorders, right? How do we separate those? How do we separate somebody with bipolar disorder, okay, that may manifest some features of um, borderline personality or narcissistic personality or antisocial personality? How do we separate it from somebody who has a personality problem?
Mm.
And what we look for is inter-episode behavior, right? What happens with personality is that personality is pervasive and predictable, right? So if you have bipolar disorder or you have depression or you have anxiety, you're only going to have the symptoms while you are decompensated. And then you're going to go back when you're
Yep.
treated or you're doing
Mhm.
better.
What does that mean, decompensated?
Well, that you're actively experiencing symptoms, right?
Okay.
So, for example, if you have bipolar disorder, you may have an episode of mania that may look very narcissistic, but once you get treated and the mania goes away, you go back to your adaptive personality. Somebody with a personality disorder is pervasive, is always there, and is
Mm.
predictable. And actually, it's in the pervasiveness and predictability that makes them vulnerable. Because we usually see the worst of them, but we don't understand that they're being so predictable, okay, and so intense, it's a vulnerability for them. We'll talk a little bit about
Hmm. Interesting. So, different than an illness, different than a disorder, then what is it?
that. Okay, so in order to understand what it is, we have to understand how behavior gets uh, defined, if you may, in terms of how do we develop a personality, right? Because you're not born with a personality, you're born with a temperament, right? So, temperament is technically your biological way of being. It's like your biological personality, right? So
Hmm.
if you go to a nursery and you look at 20 kids, all born in the last 24 hours, each one of them is different. They have something in their temperament. Some are crying all the time. Some are just logs. They don't even wake up to eat, and everything in between, right? That's your temperament, and that's inherited. Your temperament is inherited. Then as you live life experiences, from the time you're born, breastfeeding, development, assuming that you don't have any significant cognitive neurological issues, and your experiences with your parents, whether you have them or not, your experiences with your friends in school, you develop a way of dealing with life, right? So think of temperament as clay and personality as the molding of that clay based on what life is throwing at you,
Okay.
experiences, right? And technically, there's a kind of a match between personality development and cognitive development, right?
Hmm.
So, uh, because neurological cognitive development usually ends around age mid 20s, 24, 25, 26, and it's usually when we can say that personality has been developed, right? Now, there are certain events during your lifetime that make mold that clay the wrong way. For example, abandonment, neglect, abuse, uh, uh, ex- uh, sexual trauma, right? So, all of those things before puberty have a significant effect on how you perceive the world and how you react to it. When you talk about borderline personality disorder, many of people with that disorder has had a life during childhood up into adolescence of significant emotional neglect. Let me
Hmm.
explain that to you. When you're a child, the most important thing for you in your life are your parents, whether it's one or two, right? So the from the time you're born, if you get pushed away by the parents, your reaction is going to be to reattach. So we want to be attached to our parents, and we're attached to them biologically and psychologically. So if your parents are not able or willing to recognize your value as a human being, the message that they're receiving all the time is that you're not worth it. You're not worth my attention. So I sometimes I explain it as you're a child, you've been neglected until like 6, and eventually mid childhood 6, 7, 8, 9, you start developing this idea that I'm not worth it. It's like if somebody gives you a football with a label that says you're inadequate, right? So what happens is that you continue trying to get attached to your parents and try to get their attention, and you continually are being told you're not worth it. You're not worth my time. Okay. And remember, we're talking about neglect. There may be abuse associated with this, but in my experience, neglect is a lot more damaging to the self-esteem of a child than abuse itself.
Because at
Okay.
least it's a form of attention.
Exactly. So at least when you hit me, you let me know that you are paying attention to me. But if you ignore me, you're telling me that I'm not worth it. So what happens is when that kid gets to adolescence, right? What happens is that they have this football with them that is their identity that says inadequate. But friends and school and relationships become more important. But you start developing this situation where you don't want anybody to see the football.
Mm,
So you start pretending. Okay, so your relationships become very intense but very fragile, meaning that you have that need for the relationship. And that's how the development of borderline personality happens, in that you need somebody with you. You need somebody to tell you that you're worth something because you cannot tell yourself, right? So what happens is that you develop certain personality features.
and those personality features are very intense
They're
in every direction or just one. Because like again, back to the bipolar, we have manic and we have depression. We get that. What are the ways in which that is so intense? Is it all of the pieces of personality or just one or two?
No, what happens when we talk about borderline personality, there's certain features that are predictable, right? And they are persistent and they're very intense. So, what are those? If you follow the line of neglect, inadequate feelings about oneself, not liking yourself, then you have a significant sensitivity to rejection, significant sensitivity to criticism, very long lasting feelings of loneliness and emptiness. And then you have this significant need to be the center of attention, right?
Hmm.
And what happens is that the people with borderline personality disorder starts taking a lot of risks that may look uh, not highly moral, if you may, but that's not the purpose. For example, they may take a lot of sexual risks. They may do a lot of impulsive substance abuse. They may get easily into fights, right? But all of those behaviors are directed toward getting attention. And
Hmm.
that's where it gets problematic because we start criticizing them for what they do without understanding what leads to that behavior, right? So if we see it, for example, they have multiple sexual partners, right? And we start saying she's a bad person or he's a bad person because they just have sex with anybody. But for them, it's not a sexual issue.
Hmm.
For them, it's an attachment issue, right? So the same thing happens when somebody likes them. They become almost pathologically dependent on these people. They become very clingy, and that clinginess creates a situation where the other person becomes uncomfortable and pushes them away, and then becomes a vicious cycle, right?
Reinforces that.
Exactly. So because they're very sensitive to criticism and rejection, they create very intense but fragile relationships. So, from their perspective, emotionally speaking, the worst thing that happens to them is to be left alone with themselves. And very often, because they feel so uncomfortable, they do a lot of cutting, for example, or burning themselves. So that's another way of distracting themselves from themselves. So that intensity can be very self-destructive. And when they get confronted with a situation, let's say a boy or a girl who has borderline personality traits, and it starts developing those types of personality features, is in a relationship with somebody, a romantic relationship, and the other person leaves. For them, it's like the end of the world. So we see a lot of suicide attempts.
Wow.
But we also see a lot of these people who are very intense, uh, aggressively. So if you're going to leave, I'm going to hurt you before you leave, right? Because
If I can't have you, nobody else can have you, kind of thing.
kind of a situation, yes. So if you see the picture from the outside and you think about these patients coming into a psychiatric hospital, the therapist office, or the primary care doctor, they're very sweet and clingy to begin with. But eventually, you're going to do something that is going to make them feel rejected, and they're going to go from loving you passionately to hating you passionately.
Hmm.
So that's what is giving them a really bad reputation, and is that uh, therapists sometimes are not able to recognize that process. And when the patient becomes very liking of you, you feel very good. But when they start pushing you away because you did something rejecting, and they start telling you that you're the worst person in the world, then you start reacting in a punishing way. So that's why it's very important, when you're treating these patients, that you maintain your neutrality, right? Neither over appreciative nor over rejecting, because they need a safe space to express their feelings, right? Now, in a way, these patients are very regressed, if you may, into early childhood experiences. So you have this adult, now is 25, 26, 27 years old, who does not get her candy, which is you, and he throws a huge tantrum, right?
Hmm.
And then that during the tantrum, they hurt themselves or they hurt somebody else. And if you don't understand the dynamic, you're going to become part of the process. Now, remember that I said that a lot of these patients tend to be vulnerable. What do I mean by that? Vulnerability means that because they're so predictable, people can easily take advantage of them. Why is that? Because if you give them a little bit of love and attention, they'll do anything for you,
Hmm.
anything, right? So it becomes very easy for people to manipulate them, okay, into appreciation, depreciation, right? So they leave and then they come back and tell them how much they love them, and then they leave again. And the person is very um, intensely self destructive, if you may. Now, a lot of people with borderline personality disorder end up committing suicide.
What are percentages?
Well, it's not as high as the percentage in the average population for age, okay, but it's higher than the average population. So it's high, but a lot of times it's not necessarily suicidal behavior, but accidental death too,
Hmm.
right? Because you have to understand that when they're decompensated, let's say relationship 1 month, girlfriend, boyfriend, the other person leaves you alone with you. And for them, it's like being left with the worst enemy. Okay? They can't stand themselves. So sometimes they go into drinking excessively, sexual behaviors impulsively, taking risks, driving the cars very fast, right? So that puts them at higher risk of dangerous behaviors than other people.
So, if this is not a mental illness as we understand it, it's more of a disorder, which is a little bit different. How is it treated? Is it with pharmaceuticals, or is it more of a psychological, behavioral thing?
Well, you see, even in the disorders that we know, like depression, anxiety, schizophrenia, bipolar disorder, OCD, PTSD, all of those different disorders that are well defined disorders that have most of them a beginning and an end in a period of time when you're doing okay. Um, Even for those disorders, the treatments we have available are not much different than what we use in an intense personality. What do I mean by that? There are no specific treatments for any mental disorder yet. There are treatments for the symptoms associated with mental disorders. So, for example, if I give you an antidepressant, I'm not treating your depression, I'm treating the symptoms of depression
Mm.
because we're not at a level that we fully understand what's going on. Now, all treatments of any disorder, including personality disorders or any illness in psychiatry, has three factors: a biological factor, a psychological factor, and a social factor. So, if you have a patient that suffers from borderline personality disorder and the mood is so intense and is so aggressive or so self destructive that becomes accompanied by depression symptoms and anxiety, then you can use medications that we normally use to treat anxiety or depression. If we see them going into serious micropsychotic episodes because of the intensity of the decompensation, not unusually, they will start hearing voices when they're very angry.
Mm.
So you can use antipsychotic medications or mood stabilizers. Now, that's a biological treatment. Psychologically, we have to give them an opportunity therapeutically to grow a little faster by taking calculated risk under a supervision of a therapist. And the best type of therapy for individuals with borderline personality disorder is something we call dialectic behavioral therapy, or DBT, which is a form of cognitive therapy. Why do we use these types of therapies instead of traditional insight oriented psychoanalytic psychotherapies? Because they don't have the personality structure to tolerate the intrusion into their emotions when you're
Interesting.
doing psychotherapy. So if you start doing the wrong psychotherapy, you're going to make them worse, or you're going to create transferential intense issues, right? So not that it cannot be done, but it's an extremely difficult process. So you move away from the why do you feel this way into how do I help you change your behavior.
Mm.
So we're not getting into understanding as much as behavioral change. And it's kind of like a sophisticated way of dealing with a tantruming child, if you may, right? Because you're not going to sit down with a 4 or 5 year old child throwing a tantrum in the store, trying to explain to them why they're feeling the way they're feeling. Okay.
Mm.
So you move away from that into, okay, we understand that when you get rejected, you react in certain ways, and these are your options. How can I help you practice them? Right? How can I help you? How can I grab you by the hand, okay, and show you that you can take the risk of leaving this relationship and you're going to grieve, but nothing is going to happen, right? Because you don't build up their self esteem initially. You build up the self esteem by allowing them to learn that they're worth something.
Mm.
Okay.
So, how prevalent is this? I know we have numbers for bipolar, schizophrenia, all those things in our society. How prevalent is this disorder?
Well, I think it varies with different populations, but I think we're looking at a 1 to 3%
Wow,
of the
that's
population.
significant.
Well, yeah, I mean, schizophrenia is 1%, right? It's pretty high. And now, but because we're talking about personality, we have to separate personality traits from personality disorders, right?
Mm.
Because the difference is the intensity and the dysfunction. There are people that have tendencies toward borderline, people that have been partially neglected, right? So they've been successful and they've been able to move in their lives with some success and without any significant impairment of their functioning in relationships with other people. However, under the wrong circumstances, they're going to show some of those traits, right?
Mm.
but that is more temporary. So because we don't have a very good way to define who has the disorder full blown versus who has just partial features. So I tried to look more into the range, right? The person that has a little bit of everything that we consider adaptive, quote unquote, normal, and the person with a severe personality problem, whether it's antisocial, narcissistic, borderline, schizoid, schizotypal, dependent, obsessive. I mean, they have all kinds of different, and then everything in between, right?
Wow.
So it's not an easy thing, but when I'm seeing patients, I'm always looking for what is the underlying personality intensity that is affecting your depression, that is affecting your mania, that is affecting your anxiety, that is affecting your OCD. And because I work with kids, I'm very concerned always when I see a lot of kids with a lot of neglect, we see a lot of them, and they show up in the hospital 11, 12, 13 years old. You start to see their intensity, their reactiveness, their need for attachment, how they need to attack authority at times, right? So I had to make myself available to be attacked, not physically, but emotionally, without reacting to them because it's not about me, it's about them. But that becomes important because sometimes when the kid comes to the hospital because of a suicide attempt, there's this expectation that the hospital is going to change a lot of things that cannot be changed in the hospital, right? So the underlying personality needs to be taken into consideration for future treatment, but I can't change it in the hospital.
Hmm.
So I can reduce the risk of them attempting suicide or being violent and start a process of rehabilitation. But trying to undo neglect is a very significant issue. I mean, something that I tell the patients all the time is I tell girls and boys that have borderline personality, listen, you're talking to me like if you're in a prison cell with your worst enemy. And somebody come and tell you all your life that you're going to be in that prison cell with your worst enemy forever. And you keep grabbing the bars of that prison cell and you keep telling me, get me out of here. I'll do anything for you if you get me out of here. Right? And then somebody takes you out temporarily and sends you back into that place.
Hmm.
And they don't want to turn around and look at the other person. They don't want to look around at the inadequate self, right? So what do? They keep yelling and screaming at the bars, or they do things dramatically so somebody will rescue them temporarily, but they always go back to the cell. So I start by telling them, listen, let's do something. Let's close the window of the prison cell and let's have you sit down with that person you hate so much and just ignore her for a little while.
Hmm.
Let's
Interesting.
start with that, right? And that's not much different than the famous bubble of misery that you and I frequently talk about, right? Because they're demanding, they want somebody to rescue them from that person they hate so much, which is themselves. And uh, they have to learn to live with that person because, as I tell them, you're gonna go to bed with that person every night and wake up with that person every morning. So you have to choose how you're gonna deal with her.
Hmm.
I can't take you away from you.
Yeah, that's scary. They're locked in with, really, they're escaping themselves. So when someone does go into therapy for this, what is the prognosis time wise? What type of success rate is there with treatment?
Not very high. I
Hmm.
mean, you can decrease the intensity to a point that they take less risk. So think a bit about as decreasing the intensity, lowering the volume of the music so they can have a somewhat adaptive life. But there are always situations in life that are going to throw them into a crisis, rejection, criticism, abandonment, things of that sort. Uh, in my experience, because I've been doing this for more than 30 years, if you make it to 40, you start getting better.
Hmm.
Okay, so there's something about aging. It's like if there's a delay on the development of a healthy adaptive personality, you know that
Or is it
was
maybe that's how much time it takes to become friends with yourself? Or at least to tolerate yourself, if that's really the main enemy.
Well, yeah, but you see, we always have to remind everybody that you're gonna live with you forever, and the fact that, I mean, the sad part of this whole thing is that whoever gave you the football with the label, okay, they didn't know what they were doing.
Mm.
Okay, and we tend to pay a lot of attention to abuse, but we should. We get fascinated by the trauma associated with sexual trauma, and human trafficking and all of that. That is not as pervasive as ignoring kids. And there's nothing more damaging to a child than being ignored. And and we all know this because the kid will let you know, I'm here, one way or another.
Yeah, for good or for bad. Well,
Exactly.
once again, Doctor, appreciate your time. Fascinating topic, and of course, just let you know, we kind of segued into something we could talk about a lot more, which is neglect and its long-term effects on people. Again, everybody out there, please like, share, and subscribe. And we'll talk to you again next week.
Thank you very much. We'll talk about something really fascinating next week. Thank you. Have a good night.